There are obviously tons of healthcare and pharma people in the audience today. I don't think it's an exaggeration to call healthcare IT a disjointed, fragmented ball of spaghetti. Have you ever thought about taking that challenge on?
Well, I've had a couple conversations with banks about that, and it's like so many things in my life. You think you know something until you start talking to somebody who really knows about it, and you find out you just don't know much. So I don't know that I have a real legitimate opinion, but I can tell you that observing what, I'm now 59, so sitting in the doctor's office more frequently, I get a chance to see Cerner and I get a chance to see Epic, and I just think this is just agonizing. I can't imagine how somebody can live in this environment. And so I think there's great opportunities for the efficiency and the efficacy of healthcare by streamlining both the front end and back end processes inside the doctor's offices. And I talked to doctor friends of mine. One doctor, he put it quite succinctly. He said, I spend about 60% of my time with my patients and 40% of my time avoiding litigation, right? And so that's not a very good equation for healthcare. And then I've just recently been appointed to the UCSD Moores Cancer Center board, and talking to Scott Lippman there, he's one of the better research doctors in lung cancer, and he says, what's this thing called big data? He's got genome sequencers 40 feet away from him at the UCSD Supercomputer Center, and here's a guy that would rather squirt some stuff into a dish and see if it turns yellow under a microscope. So, but the problem is that when the doctors talk to these tech guys, the tech guys just want to talk tech. They don't want to talk problem solving. And that meeting of the minds, that bridge that has to be formed between the person that actually has a problem to solve and the person that knows how to build the technology is a tough bridge to build sometimes. So I think the opportunities are almost boundless. I don't know. The government's such a huge impediment, though. The HIPAA thing, Bristol Myers Squibb, Lilly, Pfizer, Johnson & Johnson are all customers of ours, and the amount of scrutiny we have to go through just to deploy new technology there is unfathomable. There's an endless line of people that want to audit, inspect, take a look and certify, and it's like a government works project. You have 5 workers and you have 500 people around, making sure they're doing the right thing. So I think government's a huge impediment. I don't know how to overcome that.